Good morning. I'm Rebecca Snyder, Executive Director of the Maryland, Delaware, DC Press Association, and I am delighted to welcome you to our first session of our Into the Newsroom series. Today, we're joined by Sean Mussenden, who is the data editor for the Howard Center for Investigative Journalism and a senior lecturer at the University of Maryland, College Park, Philip Merrill College of Journalism. So Sean is a former Washington correspondent, and he does a wonderful program on how to manipulate data through Google Sheets to really bring out investigative stories. So he's going to be teaching us sort of the how-tos of bringing that data out. And then in subsequent sessions, we'll have Alex Piles, also from the University of Maryland, talk about bringing those stories to life with social media reporting. And Adam Martin will talk to us about how to bring those stories to life with visualizing data. So this is kind of a foundational piece, and you'll use these sheets throughout the series if you choose to do that. As I mentioned, we are recording. This will be on MDDC's YouTube channel. And with no further ado, I will turn it over to Sean.
All right. Thank you, Rebecca. Good morning, everybody. It's good to see you all today. So this first course we're going to walk through today is really designed as an introduction to some data journalism basics. We'll talk about some sort of conceptual stuff in addition to the technical aspects. We're going to use Google Sheets as our tool to quote unquote interview data this morning. It's a really good sort of entry level tool for doing some data journalism work. And if anybody's interested in going further, there's lots of great classes using more advanced techniques I can turn you on to. For those of you who have absolutely no experience, this is going to serve as a pretty good introduction to some data journalism fundamentals. For those of you with some experience, but maybe it's been a while since you put these concepts into service, this is going to be just a nice refresher. So a couple things. Please keep the chat up because I'm going to ask you some questions as we go. And I'll be sharing my screen, so it may be a little tricky to find the chat. So just go ahead and take a second to make sure you can locate that. The other thing is I would strongly encourage you all to ask questions. I know sometimes people are reluctant to do that, like thinking like, oh, I don't want to look like I don't know how to do something. I guarantee you that if you have a question, somebody else probably has the same question and they're just too shy to ask. So you'd be doing us all a favor by raising your hand. So you can put it in the chat. I'll be monitoring that. Or you can just speak up, unmute your mic if I'm going too fast or something. Just let me know. If you all are ready to start participating and are ready to start paying attention, just give me a I'm ready in the chat, please. All right, seeing a lot of people awake this morning. It's very exciting. All right, excellent. Okay, so what are we doing here? So, as most of you know, the world is awash in data. It's become an increasingly important part of the information set that we rely on to do good journalism. So this could be structured or unstructured digital information, something that describes something about the world. So it might be formatted into like a spreadsheet, organized into rows and columns, and that's what we're going to make use of today. And for most of you, it'll be the main type of digital information you'll work with. But data also comes as databases or collections of scanned documents or links to things like Twitter's fire hose of information. And so as a journalist, anything you cover, any topic, there's a nearly unquantifiable number of data sets that are pertinent to that topic. So if you cover sports, right, there are data sets of game stats, of athlete salaries, of government subsidies for professional teams. If you cover politics, there are data sets on election results and campaign finance information and voter registration, personal financial disclosures by lawmakers, Facebook ad data. Okay, so let's just do a little bit of thinking here. So what about if you cover, like, say, criminal justice or courts? What kind of data might you be able to make use of? Just think about it for a second and then go ahead and drop it in the chat. Just want to see what some of your ideas might be. Criminal justice and courts. All right. Seeing crime trends. Good. Locations of arrests. So information about arrests, including where they happen. Conviction rates. Yep. So arrest, but also containing other information like broken down by race. COVID data or real estate data. Couple more, waiting for a couple more things from folks. Number, percentage of incarcerations, right? So who's getting locked up for specific crimes. Yeah, sentencing, good. Yeah, these are all kinds of information, right? Like crime data, collections of police reports. Another really common one lately is information on police shootings. Court records can be in structured data. Good. And, you know, a big power of data journalism is being able to look at equity and race. And so I'm pleased to be able to see a lot of answers there. All right, let's try something else. What if you cover, say, economics or business or the economy? What kind of data might be available there? So I already saw one, which was like real estate data, right? Information on home sales. That's good. Unemployment rates. Yep, that's a very common type of data set that people use, being able to analyze when things are going up and down, right? The movement of stock prices, really good, either individual companies or as a whole. New business starts. Yep, that's really solid. So, you know, how many new businesses are starting in a given area of what type? Economic development grants, right? What the government or private companies or nonprofits are giving out. Yeah, just a sample. Okay, good. So a couple things about sort of data sets, right? Data sets are a special kind of information. They're just one kind of information that we use as journalists. So we use documents, we use interviews, we use video and audio recordings, we use images, and people, right? We get a lot of our information from people. And the main way we get information from people is by asking them questions or getting them to tell us things. And, you know, often our stories turn on if we can find the right person and ask them the right question in the right way, we can get newsworthy information that we can use to power a news story. So we can ask questions of data too. We can interview it. And if we get the right data set, ask the right questions the right way, one of the powers of this work is we can discover newsworthy information that can lead us to a story, you know, things that we can follow up on and layer with getting documents and doing research and contextual information, getting contextual information. You know, just as you have to figure out how to interview people, you also have to figure out how to talk to data. You know, data really depends on us asking questions in very specific ways. It doesn't understand English. I can't just open up a data set and say, you know, tell me how many sales this company had in this quarter. Someday we'll get there. It'll be smart enough where we can just launch a data set, and with AI, we can just throw it English questions and it'll spit back to us, but we're not quite there yet. So a lot of the work of data journalists is figuring out how to translate our general questions, the questions we might have like in English, and translate them to something the data understand, to a language or techniques or methods. And that's what we're going to practice today. Okay, so just a couple more things before we actually get to the working with some spreadsheets this morning. A couple things that I think data journalism is especially used for. It helps us identify patterns. That's a big thing we do. You know, we're going to work with COVID data today. And so it can help us see like where cases are rising or where cases are falling. It can also help us find characters for our stories or to figure out where to go to look for a story. or to figure out if something we've uncovered, an anecdote, stands for something larger. Okay, so let's get to the technical stuff we're going to be working on today. So to set up the work we're going to do, I want you to get yourself in this frame of mind. So we have one like real goal and then one imaginary goal that's going to guide our work. So the goal here is for me to teach you some data journalism basics, how to use Google Sheets as an interview tool to safely and accurately ask questions of data. The kinds of questions, by the way, that are generally repurposable for a lot of different data sets in the future. Our imaginary goal, the one that I want to guide the exercise we're going to work on today, is this. So I'm going to paste it in the chat so everybody can see it. But the scenario here is you're a reporter for a national news organization. I know most of you are not, but we're going to pretend for the next hour and 45. And your editor says she wants you to put together a story on a place where the coronavirus pandemic has had a meaningful impact. So we know a lot of these places now. There's been a lot of coverage over the years, but we're going to walk through the process of identifying some of the sort of hardest hit places. So we're going to be working with data on rates by county. The data is a little bit old by now, so don't be using this for a current story. But there are about 3,000 different counties in the U.S. So our goal is to figure out where to go. Is pitch to your editor. Here's a place where I think there might be some kind of meaningful story, and we're going to try and narrow down the list to a manageable size, so you can do some further reporting to actually figure out a sort of location for your story. Okay, so I want us to jump into the chat here again. So if we are trying to figure out places in the U.S. where COVID has had a particularly large impact relative to other places, what are some of the kinds of things we might use to measure that? So how do we know, or what can we think of that would indicate a place has been hardest hit or harder hit than some other places? All right, so Jason says, I'm just going to Hawaii, which respect. If you can get a trip out of your editor to Hawaii, that's awesome. All right, so Alex says deaths and cases, right? Right, so unemployment rate. So how's the economy been affected? So that's something we could look at. Hospitalization rates, also really good. The most common one is probably deaths and cases. Hospital capacity. So early on, we were at the start of the pandemic looking at that a lot, right? Like places where hospitals literally could not keep up with the flood of patients coming in. So that's a good metric, right? So Jennifer says infection rates per capita. That's a really smart addition there. Different places have different numbers of people living in them. So adjusting any of these statistics by the number of people who live there might give us a truer apples to apples comparison. Good. So these are some good examples. So, okay. So, whenever we're walking through the data journalism process here, we generally want to start with questions, right? So our sort of motivating or guiding question here is which places have been hit harder than others? And then we want to consider how we're going to go about narrowing down that list. So we might talk to people who have some expertise here, get their ideas, but we're also going to need to get some data. So I'm going to share my screen here. And so I will still be asking some questions in the chat. So just make sure you can still follow along. So a bunch of different sources of COVID data. The CDC obviously has good stuff now. For most of the last year, there was something called the COVID Tracking Project that was doing the hard work of pulling information out of states and local and county health departments to pull together overall case and death and tests and other information. Another good source, and this is often true when we're looking to do data-driven stories, is there's multiple sources of the same information, and it's up to us to evaluate its accuracy. Here's a similar thing from Hopkins. The data we're going to be working with today is from the New York Times. So they, like a couple other news organizations, have tasked hundreds of people over the course of the last year in pulling together information on tests, hospitalizations, cases, deaths, vaccines, and other things, and pulling this all together. And they actually took the step then, because they've been gathering this information, of releasing it in a public format. So I'm going to paste some of these in the chat, but this is some of the data we're going to be working with today, that the Times has stored on a website called GitHub, which is commonly used by data journalists for sharing information, in addition to working with others on projects. So this is the source of the data we're going to be using. And they have a lot of data up here, but we're going to be using information on cases and deaths in counties across the country. Okay, so I've done a little bit of, I took the sort of raw data here and turned it into a format that was just a little bit more manageable for us to work with during the period here. And so I'm going to show you a Google Sheets workbook, and you will not be able to get into this yet. And I'll paste it in a second. Let me just make sure I've, yeah, okay, excellent. So I'll paste in a link to this in 1 second here. So this is Google Sheets, for those of you who are unfamiliar. It's really similar to Excel, another program that many of you may have used. This entire thing is called a workbook, and it is actually a collection of several spreadsheets in which each spreadsheet within this workbook contains different information. So we're going to look at the first one here, called COVID State US Current. And just a reminder, I've taught this class now 3 or 4 times in the last year. This data is older, and so when I'm asking questions, just keep that in mind, and obviously don't use it for current stories, because it's not correct. Okay, so I've got this data set here called COVID State US Current. And we're going to start by doing something I like to do whenever I load up a new data set, is what's called a four corners check. And 4 corners means I'm going to look at the top left corner, the top right corner, scroll all the way to the bottom, look at the bottom right and bottom left, just to get a sense of the information that's in it. So like a lot of structured data, it's organized into rows and columns. So each row represents a thing, some sort of thing in the real world, and that's key to keep in mind when using data, is that generally speaking, what it is some kind of analog or representation for something that exists in the real world. So each row is a state. So we've got a total of 53 rows. Why do we have 53 rows when there are only 50 states? Well, I think DC is a state, so that's one reason. And then we've also got a total for the US. So that gets us to 52. And then keep in mind the header row here, number 1, is it doesn't count because it just contains the column information. So so 53 rows, but actually only 52. And then each row is a state, and then each column describes something about the state, right? So Vermont, the number of cases through August 30th in Vermont was 1616. The number of deaths was 58, and the population was 624,977. So each row, sometimes called an observation, is representing something in the real world, and then each column is, some sort of specific dimension or aspect of that thing. Okay. All right, so just to walk you through a couple things here. Cases, right, is the number of cases cumulative through this date. Deaths is the number of deaths cumulative through this date. This is the population from 2018. How did I know that? If you're just presented with this sheet, how do we know that that's how to interpret that, right? Like this could just be a reporting date, but these cases could actually be through the end of July. The answer is that it's really important anytime you're working with a new data set is to look for some kind of guide that tells you what's in it. So we'll often call this documentation or a record layout or a data dictionary. In this case, I've got a nice little write-up saying what each row means. So one row per U.S. state with cumulative COVID-19 cases and deaths as of 2020 8/30. The key here is you're never going to assume you know what these things are. You're always going to look for some kind of documentation or information describing what it is. And if you can't find that, getting on the phone and calling the people who gave you the data, whether that's a state agency or some company or something, so that you're not making assumptions. Okay, so I am going to share this link, and then I'm going to walk us through how we're going to make a copy of this so you can follow along with me. Jennifer, I'm not going to show how to get the data from the New York Times site into a Google Sheet. I would be happy to meet with you separately to show you how to do that, though, if that's something you're interested in.
Thank you.
Okay, so there's the sheet. Go ahead and open it up. So I'm going to walk us through how we're going to make a copy of this entire thing. So I'm seeing all of you lemurs and lorises showing up here. So go ahead and jump in that sheet. And I'm seeing approximately 8 of you. I know there are about 18 people on the call. So I'll just wait one more minute here. And if you need me to pause or you're having trouble getting in, just go ahead and type in the chat. And I'll be happy to share screens and help you debug this. Okay. All right, I'm going to go ahead and keep going. But if you have any questions, you're having trouble, just speak up and I'll walk you through it. All right, so the first thing we're going to do is we're going to go up to File, Make a Copy. And I'm just going to make a copy and rename it with my initials at the front. So I'm going to call this SM Intro to Data Journalism 1. And I'm going to hit OK. So this will make a brand new copy that I can work in. So you should all now have your own that you can work off of. So once you've made a copy successfully, go ahead and pull up the chat and just type in for me, I've made a copy. If you're having trouble, please just type in the chat, I need help. Okay, I'm seeing, does anybody need me to hold on or can we continue? Okay, I am going to go ahead and continue, but if you're still having trouble, just raise your hand and I will back up. Okay, so let's get to our first questions. As we answer questions, we're going to follow, generally speaking, what what is often called an I do, we do, you do format, which means I've designed this so that you all will watch me do something. I'll undo it, and then we'll do it together. And then I'll have a similar task for you to do on your own. Okay, so the first question is, which state had the most coronavirus cases? Had the most coronavirus cases. So the worksheet we're on, by the way, is COVID state US current. So, you'll notice that I just said that out loud and Google Sheets didn't just tell me the answer. We have to do something, a process called operationalizing our question, which is taking our question in English and turning it into a set of steps. When we start in later examples or later data journalism classes, this means writing code that takes our English words and puts them into language specifically that the computer will understand. But when it comes to spreadsheets, it means clicking on a specific set of buttons in a specific set of orders. So which state had the most coronavirus cases? It'd be really easy to see the answer to this question if we were able to rearrange all the rows here. So the states with the most cases are at the top and the cases with the least are at the bottom. So I'll do that first. And the operation we're going to do here is called sorting. It's one of the more basic things we can do together. So I'm going to go up to, first put my cursor on column C, then go up to the data menu. And I'm going to do sort sheet by column C, Z to A. I know these are numbers, but what this basically means is the biggest value to the lowest value. Okay. So US is at the top. This data contains US. But the next one down then is California. Okay, so I'm going to back up. I'm just going to undo this. You can undo with Command Z, or you can also use this little undo button here. And I'm going to redo it. So let's go ahead and do this together. So data, sort sheet, column C, Z to A. Okay. Anybody have any problems with that? Okay, so on your own, let's answer a related question, which is which state has the most deaths in COVID-19? Remember, this is of last August. So go ahead and put your answer in the chat when you get it done, and I'll go ahead and show how to do it right after. So which state had the most deaths from COVID-19 through August 30th, 2020? Seeing a whole lot of New Yorks, New York, New York, New York, New York. All right, good, 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 good. Wait just another 30 seconds here. And then I will walk through, just as a quick refresher, how to do that. All right, so I put my cursor on column D. I went up to data, sorted sheet, Z to A, and we end up with New York. Just one thing I want to show you here as a way that you can really, really screw things up is you'll notice when we did this sorting, right? When I go to sort sheet, column D, Z to A, or sort sheet, A to Z, it sorts the whole thing, right? So it rearranges all of the rows. There is a way to sort just a column without reordering all of the rows, which is something that you never, ever want to do. But I'll demonstrate it here. So I'm just going to click on this gray area to select this D. When I go to data, sort sheet by column D, sort range by column D, Z to A. It now put the highest def down to the lowest def, but it didn't sort all the other ones. So now it looks like Alaska had 182,000 people die.
Look.
So this can lead to real problems. So just be really, really careful when you do this. Something you almost never want to do, but be on the lookout for it. Okay, so I'm going to go ahead and sort again by cases. All right, so California's at the top. So, you know, you've done this sorting, and a question is, are you going to go to your editor and say, look, I think just judge by cases. The place I want to go is California. It just had like, it's got the biggest problem because it has the most cases out of anyone. Does that logically make sense? Or if not, why not? Jason's saying no. No, because it has the most people, right? Right, we don't want to do population stories here, right? Like, you know, if you were to do something similar in like, in Maryland, all of the biggest counties, right, are going to be, are going to look the worst, mostly because more people live there. The most important variable in determining how many cases a place has had is the size, right? So we need to adjust it, right? There's a way to adjust it, and we can actually adjust it per unit of population. So cases per person, the number of cases per adjusted for the number of people who live in a given place, or the number of cases per 100 people who live in a place, or 1,000 people who live in a place. So I'm going to show you how to write that formula. This is one kind of a formula that we can use. So the first thing I'm going to do is to calculate the number of cases per unit of population in a given place, is to create a new column. So I'm just going to go ahead and watch me do this. I'll undo it all. We can do it together. So I'm going to insert a column. All right. And I'm going to call this cases per person. You'll notice you can only see part of it. So we can actually make the column bigger just by hovering until this little arrow pointing up and to the left turns into a horizontal arrow, and I can drag this over. So we're going to write a formula. Another word for a formula is a function. A function is you know, some of you may remember this from like algebra and other things, but it's really just a specific set of steps that you're going to apply to some of your information. So we're going to pass in a number to our function. It's going to spit out a different number. Another way in the real world I like to think of this is like recipes. When you're making food, those are functions, right? You have a specific set of steps you walk through to make the food. You take the ingredients, pass them through the recipe, and at the end you get your cooked meal. So what is our question here? How many cases per person were there in each state? And then which state had the most after adjusting for population? So that's the English question, but we need to operationalize it here. So in order, the steps we're going to take to calculate this are dividing the number of cases by population. So in Google Sheets or Excel, functions always start with the equal sign. So equals, and now we're going to divide two specific numbers. So I could like hard code this in, I guess, right? And divide 706,589 by the population of California. So 391,48760. That's a lot of work. It's a lot of work. So instead, we're going to use sort of the names of these locations. So anybody who's ever played the board game Battleship will understand this, right? Each of these individual boxes are called cells, and we can locate them through their position, right? So this first box up here is A1. So it's in column A, row 1. This one here is C3. It's in column C, row 3. So to get California, I'm going to divide equals C3. You'll notice it comes up with this really handy highlighting to show me which cell I'm working on, divided by E3. Okay. I'll talk about this autofill thing in a second here. All right, so how do we interpret this? In California, there were 0.018 cases per person as of August 30th, right? So for every person in the state, there was like, I don't know, 2/100ths of two tenths of a case. It's not a super pretty number. We can actually like make this a little better by multiplying it by 1,000. So now we get 18 cases per person. And now this is no longer cases per person. So I'm going to change this column name to be cases per 1,000 people. Okay, so, I could, hold on one second, y'all. Okay. So I could just retype this like in each one, right? Equals C3 or C4 divided by E4 times 1,000. It's going to take me a while with 50 states. If we did this for counties, it would take years. So instead, what I can do is I can just hover over this little blue box here with my you get a cursor turns into a plus sign. And if I just double click, it fills all the way down. Okay. And now if I sort, if I do my sorting, by this new column, the answer is Louisiana. So I get 31. Feedback. There we go. So we get 31.74 out of 1,000. So that's the answer there is Louisiana. Okay, so I'm gonna undo all that and walk through it one more time. And if you haven't been following along with me, let's go ahead and do it now. So first thing I did was I went to insert one column to the right. And I gave this new column a name. So I'm going to call it cases per 1,000 people. Because it's hidden, I'm going to drag the column to make it bigger. So I can just hover over the edge here till it turns blue and then drag. And now I'm going to write a formula. So the formula I'm going to write is I want to divide cases by population. So equals C2 divided by E2. And then because that number is really small and a little bit unwieldy and maybe hard to put into a news story, I'm going to multiply it by 1,000. And I could do my little fill down trick, but Google Sheets has a lot of really nice stuff built in. And it's doing this thing called suggested autofill. So I'm just going to go ahead and check this box, and that will fill this all the way down. Then the last thing I'm going to do is sort by column F. And we get Louisiana at the top. Okay, any questions about that process? All right, on your own, I'd like you to answer a really similar question. Which state had the highest death rate per 1,000 people? And which state had the lowest? So go ahead and follow the steps that you'll need to answer that question. And then once you get it, go ahead and paste it in the chat for me. All right. Seeing New Jersey and Hawaii. Yeah, you booked that trip. How has Hawaii been able to avoid the worst of it? At least as of last August. That's a story I want to report. Okay, New Jersey and Hawaii. All right, we're going to take just 1 or 2 more minutes here, and then I'll walk through how it's done. And a reminder, if you go ahead and get the answer, go ahead and drop it in, please. Okay. Okay, 30 more seconds, and then I'm going to walk through how it's done. And remember, if you're having any issues or don't understand something, please drop a question in the chat or just go ahead and unmute and speak up. Okay, so I'm going to walk through how we did that one. So I'm just going to create a new column called deaths per 1,000 people. And really similar to what we just did. So equals D2 divided by E2 times 1,000. And I'm going to go ahead and autofill this down. And then going to sort it by 2 different ways. So sort sheet by column G, Z to A. We get New Jersey at the top at roughly 1.8 per 1,000. And then I'm going to do the, I could just scroll down and look at the bottom, and that's Hawaii. But I can also just data sort sheet columns G A to Z, and we get Hawaii 0.04 per 1,000. These numbers are so small that we also might consider multiplying by, say, 10,000 or 100,000. We'll make it more readable when we ultimately want to drop this into a story, which is part of our goal, in addition to using it to guide our reporting. Okay, so we're going to do the next question totally on your own. So I'm going to drop this in the chat, and I'm going to create some breakout rooms in case people get stuck here. So let me go ahead and stop my share and do that. So I'm going to create, now we got like 10 people. I'm going to create 4 breakout rooms, and I'm going to open in 1 second. So the question I want you all to ask, that we're going to ask here, is which county had the highest death rate per 1,000? And which county had the highest case rate per 1,000? We're trying to get a little more specific here in figuring out where we might go to report out a story about the impact of the virus. So the sheet you want to use is COVID County Current. It's very similar to what we just looked at. The difference is that instead of 1 row per state, we have 1 row per county per state. So for Alabama, right, there are something like 70 counties, 67 counties. So I'm going to go ahead and open up the breakout rooms, and I'll be jumping around to see how you're doing. So go ahead and jump in now. Pull up our sheet again. All right, as soon as people get in, we will, I'll walk through this, and then we'll move on to our next question, which will allow us to learn a new technique. Okay, so I'm going to insert, okay, so go ahead and type the answer you got in the chat, please. So which one had the highest, which one had the lowest? So if you're just coming back, go ahead and type in the answers you got into the chat, please. Which one had the highest death rate? Which one had the highest case rate? Okay, so deaths, I'm seeing Hancock, Georgia. Cases, we got Trousdale. Highest death. Oh, Jason, you also did highest and lowest. Cool. Okay, so highest death was Hancock, lowest death was Preston. For cases, highest death, Trousdale. Anybody can yeah. All right, cool. So I'm going to go ahead and share my screen here again, and I'm just going to briefly run through a couple things here. So first, I'm going to insert a column to the right. We're doing this for both, so I'm going to insert 2 columns actually. So we're going to start with the cases per 1,000 persons. We're going to call this deaths per 1,000 persons, and going to do the formula right quick here. So equals D2 divided by F2 times 1,000. By the way, before I fill down here, one thing you may notice is this is a really unwieldy number that's like hard to look at. Up here in the toolbar ribbon, we have formatting options. If I hover over this decrease decimal places one, I can make this like a little more presentable. So 26 cases per 1,000. Now when I fill down by double clicking, it's just a little bit prettier. One thing I also wanted to show you is, you can copy formulas. So I'm going to copy this, Command C, and then Command V to paste that in. Sometimes things go wrong when you do that. So when I copy this formula, here it was D2 divided by F2 times 1,000. When I copied it over one cell, it just moved everything over. So E2 divided by G2, that's not right, right? We actually want E2 divided by F2. So when you're copying formulas, just pay really close attention. And I'm actually gonna make the decimal places a little bit smaller here. Okay, so now we just need to sort. So I'm going to sort the sheet by column H, Z to A. This is deaths. So we get 4.57. That's Hancock. That's what most of you got. I'm going to do the same thing. Sort sheet by column H, A to Z. Sort sheet by column G, Z to A. We got Trousdale at 169. I forget who had this question now, but somebody sorted by column H, A to Z, and got all these like zeros. And it wasn't until we got way down here that we actually had a non-zero value. So if you're asking the question, right, which county had the lowest death rate? Well, here's 10 that were like at 0.01 or so, but there's all these with zeros. And so the question was, in a story, right, would you say La Crosse, Wisconsin had the lowest death rate? No. What you might say is it was among a group of counties that had at least one death that had the lowest death rate. So all these here are zeros, right? That's because they had no deaths. So just sort of thinking through how to say something is an important step here. Okay. All right. So I think it might be reasonable to assume that sort the sheet here. Column G, Z to A. Okay. All right. So again, remember our goal, right, is to find a place where there are plots, where there's likely to be, sort of a more pronounced issue with COVID than other parts of the country, at least as of last August, right? So Trousdale, right, 169 cases per 1,000 people. Is it, the virus was more widespread there than other places at that point in time. So reasonable to say to your editor, I think I'm going to make some calls there, but I think there's a story about the impact that we could report out locally. Okay. All right. So in this scenario, your editor basically says, we don't have travel funds to send you to Tennessee. I'm sorry, but you can go to anywhere in DC, Maryland, or Virginia. So it's going to be useful in that case to be able to look at a subset of counties that are just in these places. And the way we subset data, the way we look at only a portion of it based on certain condition, are called filtering. So I'm going to start with a question, which is, okay, so which Virginia county had the highest rate of cases per person? So go ahead and watch me do this, and then we'll do it together. And then I'll have you do sort of a similar thing on your own. So the first thing is, I'm just going to put my cursor in this first column, and then I'm going to go up to data, and I'm going to click this tab here, or this drop-down menu that says create a filter. So you'll notice I get these fun little green like drop-down arrows here next to it. When I click one of these things, it gives me options. So when I click here, it pulls up this pop-up window. And I can clear out all of them. And I'm just going to type Virginia and check this and hit OK. And so now all of the counties, and actually Virginia is kind of a weird place where they formally have cities and counties defined as part of their official geography. Now we're looking just at a list of Virginia. So this filtering is a very useful thing that applies to all kinds of data sets that you're going to work from. All right, so the answer in this case for cases per 1,000 people, highest rate of cases, is Greensville, Virginia. Greensville, Virginia. Okay, I'm going to undo this and go ahead and walk through this with me. So first thing is I clicked in this first row. I went up to data, create a filter. And I click on the little green dots there, green lines. Right now, all of the states are checked. So I'm just going to click this button that says clear, which will uncheck all of them. And I could just scroll down to Virginia, or I can also start typing in this box, Virginia. Hit OK, and it just gives me. OK, so on your own, I would like you to tell me which area in Maryland has the highest rate of cases per person. And so when you get that, go ahead and type that in the chat, please. So right now our data set's filtered just for Virginia. We want to look just at Maryland. Georges, Prince George's. All right, seeing one answer for PG. PG, PG. Okay. So I'm just going to go ahead and walk through how we switch that. So again, I'm going to hit clear. And I'm going to go down and select Maryland. We're still sorted by cases, so we get PG. Okay. All right, so you're all set. You're thinking I'm going to PG County, and your editor says, I've read 1 million stories about COVID in PG County. Maybe find me a smaller county in Maryland where there's been less coverage. So we can also use filters to do this. In the same way we filtered text here, we can also filter for numbers. So the way I'm going to operationalize this question is I'm going to say, let's look at just places where the population is under 100,000. So we're going to get rid of our Baltimore cities and our Montgomery. So I'm going to click on the population filter here. And now we've got this drop down for filter by condition. So filter by condition, and there's a bunch of options. Text contains, text doesn't contain. If we're talking about a date, it's before a certain date or after. Or all of these things that have to do with numbers, greater than or equal to, less than or equal to. So I'm going to put less than or equal to, and I'm going to do 100,000, and then I'm going to hit OK. And now it gives me only those counties where the population is under 100,000. So like Calvert is included. That's the biggest one under 100,000. So we get Worcester. I'm going to undo that. And then I'd like you to do it with me. So I'm just going to population. I'm filtering by condition. Scrolling down to less than or equal to. And then under value or formula, I'm writing 100,000. And then I'm going to hit OK. And the answer we get is Worcester. So a couple things here, right? We can apply as many filters as we want to as many columns at once. That's important. And it's a really handy way of subsetting and looking at large data sets. So yeah, so that is filters. Okay. So far,
Sean, I'm sorry. Do you mind doing that one more time? I completely couldn't. I missed the part about how you get the second filter.
Yep, absolutely. So I'm going to turn this off. Okay. So right now, right, it's just filtered by Merrill. By one way, by the way, we know that a filter is on in a column is that it's turned from these 3 line triangles into a funnel, a dark green funnel. So we still have our Maryland filter on. So I'm going over to my population column and I am clicking the 3 triangles. And instead of filtering by a specific value, right, like I only want to see the county where the population is 19,593, I'm doing this thing called filter by condition. So I click this drop down.
So, and I'm sorry, that's where I'm lost. I don't have those 3 triangles.
Oh, do you have Maryland filtered or no?
Yeah, I have Maryland filter, but then none of the rest of my color has this triangle.
Ah, okay. Let's do this. So click this gray box here in the upper corner, upper left corner, and that will select the entire sheet. Did that work for you?
Yep.
Now go to data. And let's just go ahead and remove the filter. And then go back and redo it, create a filter.
Okay.
Do you now have the green?
Yeah, sorry, I don't know if anybody else was having this issue.
Yeah, it's weird that would I wonder if that column was selected or something when you created it. Did that work?
Yes. So you can't have the column selected when you create it.
Yes, I think that's right. Yeah. Okay. Or it'll only create it for the one.
Yep. Okay. Now I think I got it.
Cool.
Thank you.
Okay. So so far we've been asking questions that, sort of tend towards extremes, right? The most and the least of these things. Most and the least, right? What is the most? What is the least? Where is the problem the worst? Where is the problem not as bad? And this leads us to some potentially interesting stories, right? Like we may travel to a county like Worcester or Trousdale, Tennessee, or Hancock, and figure out what's going on there, right? Or we, at the other end, right? We might look at the story Jason's been pitching about going to Hawaii and figuring out how, at that point, they had avoided sort of the worst of problems. But averages are meaningful too, not just from a reporting, not just from a story perspective, but from a reporting perspective. Like, how can we figure out where the experience has been generally typical? Can we go to a place that sort of stands for the experience of the country at large? So for that, we're going to write another kind of formula. And that formula is used to calculate averages. Okay, so let's see here. So I'm going to keep it on Maryland. And I'm going to turn off this 100,000 filter. Okay. And actually, I'm going to turn off Maryland too. So I'm just going to select all of these. Or we can just turn off the filters for now. So go up to Data, Remove Filter. Okay. So let's go ahead and calculate the average cases per 1,000 people across the country. So one way I can do that is by inserting a column to the right here. And I'm going to call this average cases per 1,000. And then I'm going to calculate the average of this column. So again, we're writing a formula here, right? We're going to take a bunch of numbers. We're going to pass it through something and spit out a number on the other side. So we start with equal. Google Sheets is smart enough to know that I'm probably going to want to write an average because my column here says average. It's not smart in that it's thinking I want to average these two numbers together, which I don't. So I'm just going to write equals average. And then we're going to feed it a range. So average is a built-in formula or function, right? So I'm going to write G2, and then I'm going to write a colon. And if I scroll down to the bottom here, this last one is 3124. So G3124.
Wait 1 minute.
So what it's done is it's averaged together all of these
Change
numbers.
the passport, so I had to remember. Yeah, okay.
Added all these together from G2 to G3124, and then divided it by the number of rows. That's how we calculate the average, but it's a handy little convenience function. All right, so the average cases per 1,000 is 14.4. So Trousdale, right, is almost 10 times the national average, or Chattahoochee is 7 times the national average. Okay, so on your own, I would like you to calculate the average deaths per 1,000 people. On your own, average deaths per 1,000 people. And once you get that, just go ahead and drop it in the chat. All right, seeing some 0.3. Okay, 0.3, 0.3. Okay, I'm going to go ahead and walk us through how we did that. So I'm going to insert a column at the right here. I'm going to call it average deaths per 1,000. And I'm going to write a formula that's remarkably similar to this one. In fact, it's so similar, I can really just copy and paste it. And it worked fine. just so happened when we pasted it into a column that was 1 over from this one, Sheets was smart enough to know that the range we're picking wants to come from that one. So we get 0.34. Yeah, so from a story perspective, right? Like, you know, Trousdale, it's got a death rate that's essentially twice the national average. Or a place like Galax City, Virginia, the death rate is more than 10 times the national average. Pretty big stuff. Okay, I want to show you one more really useful formula that it comes up all the time in sort of basic data journalism work, which is looking at how things change over time. So another way we can look at where things are rapidly becoming problematic are places where not just the total number of cases per 1,000 people or deaths per 1,000 people are bigger than other places, but also places where they've jumped a lot recently relative to the state of affairs like a month or so prior. So, you know, this data was through the end of August 2020. And so the question I want to ask here is where has the number of cases per person gone up a lot in recent months? So I have another data set for you that we're going to work from. It's called COVID County Monthly Case Rate. And I want to talk about how this information is structured. So what we're looking at here is, again, each row represents a county and a state. But instead of having like columns for, you know, deaths and population, I've already done that math for you here. So that what we have is for each month, at the end of each month, this was the cumulative case rate in that place. So in Autauga, Alabama, the case rate at the end of August was 26 cases per 1,000 people. In July, it was only 18 per 1,000. So, you know, a pretty sizable, almost a 50% increase between July and August. Or Baldwin, right? In August, the case rate was 21. In July, the case rate was 14. So it's gone up quite a bit. A question we might ask here is to operationalize our question of where there have been big increases recently, is where has the case rate jumped the most between July and August? So I'm going to show you how we're going to do this, and then we can do it. We can do it together. So I'm going to insert a column at right again. And then I'm going to call this column July, August change. And again, I can drag it out. And so if I wanted to just calculate the, you know, sort of raw change between 18 and 26, really what we're talking about here is subtraction. So equals H2 minus G2. So the case rate, cases per 1,000 people went up nearly 8 between July and August, which is useful. There's definitely some useful information there. Like if we sort here, we'll see that in Lafayette, Florida, the case rate went from 11 in July to 137 in August. It's a huge jump. One thing though, the way that this might sort of bias our results a little bit is that places that had very low case rates, the sort of absolute change in numbers may be small, but for that county, it may be really meaningful. So I'll show you an example of what I mean here. So going from 2 to 18, right? In Golden Valley, North Dakota. That's a huge jump. I mean, it's like 9 times, like a 9 times increase between July and August. Its absolute increase was 16.47. Then you got a place like Stark, North Dakota that went from 5 to 21, right? It started at a higher level. Its overall total increase was still pretty big, right? About equal here, but it only went up sort of 4 times. So when we're doing this kind of thing, I like to calculate not just sort of the raw difference, but also the percentage difference. So we're going to calculate that now too. So I'm going to insert a column to the right, and I'm going to call this July-August percent change. And there's a handy formula for calculating percent change over time, which is new minus old divided by old. New minus old divided by old. So in this case, equals new, that's H2. I'm going to put this in parentheses for order of operations, minus old, G2, divided by old, G2. New minus old divided by old. And then I'm going to turn that into a percent and fill down. So what are we looking at here? An 1,100% increase between July and August in Lafayette. And if we sort, we get a bunch of divide by zeros, which is a problem because basically these are places that had no cases at all reported in July and a bunch in August. But loose Michigan, right? It went from 0.6 cases per 1,000 people to 19. That's like a 30x increase, really big, right? Okay. So I am going to, what I'd like to do is for you all to calculate this on your own, but now using the monthly death rate. So let's use this sheet and let's calculate July-August change and July-August percent change. So go ahead and create 2 new columns. And the question we're trying to answer is which state or which county had the biggest percentage increase in death rate between July and August. That's the question we're trying to answer. Which county had the biggest percent increase in death rate between July and August? When you get that, go ahead and drop it in for me. Which county had the biggest percent increase in death rate between July and August?
Do you want us to exclude the ones where there was 0 in July and then?
Yeah, go ahead and exclude the ones where there was 0 in July. Those still may be really meaningful from a story perspective, but right, seeing two different answers here, Luce and Effingham and Brooks. All right, let's
Oh, I
take a
was
couple.
looking at the wrong thing.
Oh, okay.
Disregard my answer.
Let's take a couple more minutes here. Let's take a couple more minutes here. Okay, I'm going to walk through this one. So I created a new column called July, August percent change. And then I'm writing a formula. So it starts with equals. And then the formula is new minus old divided by old. So new, that's the August value. That's H2 minus the July value. That's old, G2, divided by old. That's G2. Okay. New minus old divided by old. H2 minus G2 divided by G2. I'm going to format this to make it a little prettier. Then I'm going to double click to fill down. The last thing I'm going to do is sort by column I. We get a bunch of divide by zeros because of reasons. And ultimately we end up with Effingham, Texas.
Georgia.
Effingham, Georgia. Or Brooks, Texas. So big percentage increase. You know, Effingham's an interesting one, right? Like its case rate is still, or death rate is still like pretty low. Whereas Brooks went from a, you know, decent sized number to a death rate of 2 is pretty substantial. I think between the two, I would probably pick Brooks as a place to go as opposed to Effingham. Okay. All right. So we have about, I think, 20 minutes left or so. I've got a couple more things that I could show you or demonstrate. But I also want to open it up in case there are things that you would be interested in me showing you, or things you've heard you might be able to do. And if there's not time to do a full explanation here, I can turn you on to some resources where you can learn more about those things. But yeah, I'll open it up. Does anybody have anything that they've been thinking they'd like to know from Google Sheets or other techniques that would be worth talking about with the group?
Sean, do you want to stop sharing your screen so we can see everyone?
Yes. Anybody have any techniques or things that they'd be interested in hearing about?
For those of you who are going to be reporting with Google Sheets, are there particular topics that you guys are thinking would be would you want to concentrate on, and maybe we can brainstorm data sets that would help explain some of those story ideas?
Yeah, for sure. What people are covering this year. I love doing that. Also this summer, if as you're working and you're wanting to know those kind of things or you have questions, feel free to email me. I love talking that stuff through with people.
Yeah. And Larry, you're doing a capstone project over in Delaware. Do you feel like there are data sets that you would want to pull out or need ideas on?
The answer to the question is yes. I have not gone looking for the data sets yet. Sean, just so you know, the project that we're going to be working on is the impact of COVID-19 on the Latino population in Sussex County, Delaware. So, I'm sure there's lots of data there. As I said, I have not gone looking for it yet, nor have any of my 4 interns, as they're just starting this week.
What are some of the impacts you're thinking of considering when you say impact? Health?
Certainly, education is one issue. I'm not quite sure what we're going to be able to find in terms of data that relates to the just concluded school year, but education would be one. Various issues related to employment, unemployment, loss of jobs. I think in a more general way, obviously, rates of vaccination, whether the vaccination rates are significantly different among the Latino population as compared to the county as a whole. Those are some of the more obvious issues. Anyhow,
can you get in Delaware? Do they have zip code level vaccination rates?
I believe so.
Yeah. So there's some really interesting stuff you can do by connecting those zip codes to census data around population, and in the census, it's Hispanic is they classify it as ethnic origin as opposed to race, but you can actually dig into that question to look at vaccine rate disparities. Would be one idea. In terms of education, I mean, are you thinking like school attendance? Are you thinking about like educational outcomes of the last year?
I think attendance is probably one that's would be more accessible at this point than outcomes, because to the extent that the statewide testing program was operative, the tests were given in April and May, and they typically don't get results out, and certainly not at the individual level until the start of the new school year, which by then Z and Johnny and my other interns are going to be back to school wherever. So
there's a Department of Ed runs something called the NCES, National Center for Education Statistics, at the national level. They have a ton of information, like at a school level, of race and gender makeup of individual schools. And if you can get sort of like attendance data baselines by school, that could be another lens you could look at it. Would be potentially really interesting. The testing, it's right, like it's usually there's like a several year lag on that information. Yeah, sounds like an interesting project. Are you looking Sussex? Is that mostly more like farmland, rural?
Yes, Sussex is the most rural of the 3 counties in Delaware. It's the southern part of the state, and there's a fairly significant contrast from at the coast with Rehoboth and Dewey and Bethany and so on, and then as you move more inland, closer to Maryland, it becomes much more agricultural.
Are you looking at, is part of what you're looking at, like, we just had a project kind of on this on seafood and farm workers, but migrant farm workers who are on like H-2B and other visas from Mexico and Central America?
That's probably something worth looking into. We have not, as I said, we haven't really gotten started on the project, but yeah, that's a good point.
There's so like chicken houses and then processing plants were among the sort of like most dangerous for COVID.
Right. Yeah. We're well aware of that. Yes.
Yeah, and there's good data on sort of the flow of H-2B visas, and there's really good data on COVID outbreak at individual plants that could be useful too.
Okay. And what agency would be most likely to have that?
So OSHA.
OSHA. Okay.
OSHA has that. Yeah. They've been releasing on their site specific COVID related complaint and enforcement information, which would be, you can just download it from their website. It's really easy to get.
Okay, that's that'll give us some good places to start looking then.
Cool.
Other questions for Sean? I know it's a 2-hour Zoom is an exhausting Zoom, so thank you for rolling with us. When many of certainly our interns are just starting their summer projects. So last call for questions, cries for help. All right.
Rebecca,
Well,
this is not exactly a cry for help. Well, it is an advanced cry for help, but Sean was gracious enough to mention that if people want to contact him over the summer or whatever, Sean, is there an email address you can share with the group?
Yeah. So best thing is, I'll put it in the chat, is my UMD address. And yeah, I'd be happy to help with if you got technical things you're running into or just want to brainstorm like data availability, just let me know.
All right.
And he is terrific in doing that because we worked together. One semester I ran the Washington Bureau for the Merrill College of Journalism. And I don't know how many times, Sean may remember, I don't know how many times I told my students, that would be a great thing to ask Sean.
Was it just one semester, Tom? I got it.
It probably seemed like several years, but no, it was only one semester.
Oh, wow. Okay. Yeah, I seriously, it's not an idle thing I put out there. I love doing it, so let me know.
Okay, and then I'm going to do my little plug for our upcoming sessions. You can use all of these wonderful data sheets that Sean has shared with you and you've worked on in our visualizing data session, which is going to be June 22nd, 9:30. That's when Adam Martin will demonstrate the power of data visualization. So you can use this data set or another one of your choice. So it's helpful. That session is going to be 75 minutes. So it's going to be another long one. But this part of the series is taken out of a capstone course that Sean and Adam and Alex have done at the University of Maryland. So it's a really cool program. Next week, June 16th at 9:30, which is a Wednesday, implicit bias in the media and how to minimize it. So Phil Friedman of the News Journal and John Williams of the Baltimore Sun will talk about some of the projects that they've done to discuss things like language, like is it gun control or gun safety? Is it a riot or is it an uprising? You know, those types of things, as well as understanding just how systems can be set up against others. And then June 30th, we have Objectivity and Reporting, this time through a sports lens. Can you be a fan and a reporter at the same time? Pro tip is no. And so Kevin Richardson and Daniel Oyefuzi from the Baltimore Sun, who are sports reporters, will talk to us about their ongoing quests for objectivity. So there's a whole bunch of great sessions coming up. I would urge you to spread the word. They're open to everyone. They're completely free. And you can find it on the homepage at mddcpress.com. We have recorded this session. It'll be up on our YouTube channel in the next day or so. And I thank you all so much for coming out and joining us. This has been great. And thanks very much to Sean for sharing his expertise.
Thank you so much,
And that-
Sean.
Great job, Sean. Thank you.
Thank you, Sean.
Thank you.
Thanks, John.